So I'd like to introduce myself again. My name is Dr. Ammu Thulaseedharan, and I'm a specialist psychiatrist with ZIVANZA quaternary care in Dubai. It's a privilege to be a part of this group, which actually extends help to patients worldwide. So this is my first webinar for the ZIVANZA group, and I'm happy to actually present a topic that is very relevant, but unfortunately, it's overlooked in our busy 21st century life. We don't seem to give a glance into it. The topic for today is the impact that stress has on health, and I will be talking about the impact on physical as well as mental health. So let's begin with what is stress? How do we define stress? What we need to know is the very existence of biological stress was first demonstrated by Dr. Hans Selye. He was actually a pioneer endocrinologist of the 19th century, a multiple times Nobel Prize nominee, and he had actually also coined the term stress. Now, so I'm guessing he's definitely the expert to give the definition of stress, and he had defined it as the feeling that we actually experience when we are exposed to a situation which is challenging or overwhelming. Hans Selye further divided stress into two types. One is what we call eustress. Eustress is not a very common term that all of us have heard. Eustress is actually more of a positive stress, which occurs following a happy event or a new or exciting event. On the other hand, distress is a term that we actually use in our day-to-day communication. Now, distress is one that follows a negative event. What does stress comprise of? How does it all begin? Okay, so first of all, when do you get stress? Where there should be an event that actually causes this particular stress, and that is what we call or define as stressor. The stressor can be many things. It can be the death of a loved person, a divorce or a separation. It can be losing a job. It can be about unexpected financial issues. This is what was defined as distress by Hans. And positive stress are like, getting moving on to a better place or a bigger house or a better job or, promotions or going on a holiday and the planning involved behind it. Now, that is what was defined by Dr. Hans as eustress. Following this stressor, what happens is the body undergoes a lot of physiological as well as psychological changes. Now, these are what results in overstimulation if the stress continues to persist. And that results in a resulting disease, which is what we call as stress effect. This stress effect is usually what results in the disease, and this disease is what we psychiatrists usually refer to as anxiety disorders. Now, what is the difference between stress and anxiety? Stress is usually a response to a particular threat in a situation, and anxiety is the reaction which we have towards that stress or that response for that matter. Now, anxiety is what we refer to as the pathological state, that is the state where we need to seek help for our stress. When exposed to the same kind of stressor or the stressful situation, some people tend to adapt to it. They learn to cope with this new difficulty and they learn to live with the new situation. That is what Dr. Hans referred to as general adaptation syndrome. On the other hand, there are other section of people that makes majority of the people who develop a pathological state which they find very difficult to cope with and even more difficult to overcome. And this ends up affecting their day-to-day function. Now that results in the previously mentioned pathological state. What happens here is, in this pathological state, we feel that our stress response is very persistent. And over time, when we are actually expecting it to improve, it's not improving. We are not able to overcome it. In fact, it's getting worsened. So, what happens is there's physical and extreme mental exhaustion, which puts the body under a state of constant pressure. Now, what we need to ask ourselves, whether before you have a doubt that whether you have already entered the zone of anxiety, is there are two important questions that you can ask yourself. One is, does stress have an impact on your sleep or on your appetite or your sexual function or your daily function for that matter? The second question, and the most important question you need to ask yourself, is, have you ever wondered that do you feel like you would have been a much happier or a much better person if you had been a little less stressed? If the answer to any one of these questions is yes, then you have unfortunately stepped into the pathological zone of anxiety. So the next thing you will automatically ask yourself is, why me? Why is this happening to me? And what is happening to me? Why can't I be like others? That is the normal people we see every day. Why am I not able to adapt? Why am I not able to move on? What you need to understand is, even though you feel that these reactions, they're not under your control, they can actually be rectified. There is a remedy for this. Now, the reason you need to understand first as to why this is happening to you, the reason is solely because of hormones. Hormones are actually the main culprit behind this. Now, many hormones are responsible for stress reaction, but today I would like to cover two most important hormones that are responsible. That is, one group is the catecholamine group, and the other is the glucocorticoid group. Out of catecholamines, epinephrine and norepinephrine are the most important ones responsible for the stress reaction in our body. Epinephrine is also called adrenaline. I'm sure like many of them may be very familiar with that term adrenaline. And what happens here is, when you are exposed to a stress, a lot of epinephrine and norepinephrine is released into the body. This is what ends up in a fight or flight response. Now, flight or fight response, how do we experience it in our body? There are two set of symptoms that we experience, one internally and one externally. Now, what we experience internally are the following. There is an increase in our cardiac output. The blood flow to our skeletal muscles is very high. Also, there is sodium retention. Our intestinal movement, which is very much important for digestion, will be reduced. Our vessels, blood vessels, are all constricted. When exposed to stress, there will be a sudden surge or an increased quantity of glucose in the body released. Also, there is bronchial dilatation, and last but not the least, behavioral activation. Now, when these changes are happening internally in the body, what happens is it will demonstrate externally as the following set of symptoms. That is, you will have a very unpleasant or a vague feeling of apprehension, or you feel like an anticipated worry of something is going to go wrong. That is how usually my patients tell me, that I feel like something is going to go wrong. And these set of feeling is associated with a set of symptoms. The first symptom, most commonly seen, is you will have heaviness of chest. You will feel like there's a lump in your heart or a lump of your throat or chest cavity. The second and the most alarming feeling is palpitation. Here, a person actually becomes aware of his own rapidly beating heart, okay, which is pretty alarming for a person who's never experienced it before. Naturally, when you have this heaviness and palpitation, a person tends to be restless. And following which, some people develop dizziness, that is, you feel very lightheaded. And following which, you will have headache, you can have abdominal discomfort. Abdominal discomfort, sometimes it's not like how you have the happy butterflies in your stomach, not the excitement butterfly, it's more of the nervous clenching of the stomach. And perspiration, that is like you'll be drenching in your own sweat kind of a feeling. The next set of hormones that are responsible are glucocorticoids. Now, what happens here is, When you're actually exposed to a threat, stressor or a threat, now there's a part of our brain called hypothalamus. This hypothalamus actually secretes the hormone called corticotropin releasing hormone, which further acts on our pituitary gland. The pituitary gland further secretes adrenocorticotropic hormone, which we refer to as ACTH in short, and this acts on tiny glands called adrenal glands situated right above our kidneys. Now, as part of this action, adrenal gland ends up releasing cortisol. Cortisol is one of the most important glucocorticoids responsible for the stress reaction in our body. When cortisol is released, what happens is cortisol ends up converting the protein in our body into glucose by a process called gluconeogenesis. Now, why does our body do this is the fight or flight response that I mentioned before, like when you're exposed to a threat, that requires a lot of energy. A lot of energy is burned in the fight or flight response. Such energy will be derived from this glucose that is converted by cortisol and formed by gluconeogenesis. As a result of which, what happens is the blood sugar levels at that point of stressor rises in our body. Now, what happens here is normally when the stressor resolves, you can see that that is when the stressor is gone, you have learned to adapt or to adjust. What happens is there is the further release of the corticotropin releasing hormone is actually stopped by a inhibition mechanism. But what happens when you're continuously stressed, when you haven't adapted and the stressor is probably still present or you are not able to cope or adjust? That means there is a persistent stressor. So what happens here is that the cortisol levels keep rising. So naturally the glucose levels keep rising. As a part of it, you go into a state of persistent hyperglycemia. That is, you become diabetic. Or if you are a previously diabetic patient, you will even have insulin resistance, which will worsen your diabetic status. Also, your blood pressure increases, resulting in hypertension. You can have increased cholesterol levels, resulting in dyslipidemia. Naturally, when you have these disorders, your body's immunity goes down. So you are in an immunocompromised state where you are more prone to other infections and diseases. Also, increased cortisol can affect with your clotting. That is, if you bleed, it's very difficult to clot. That can even result in conditions like stroke. Next, the most important one is osteoporosis. That is, your bone density tends to reduce. This is very commonly seen among women. In females, excessive stress can actually precipitate osteoporosis, which is usually seen after the age of 55 or 60, will be seen at an age of 35 nowadays. Also, increased cortisol inhibits your neurovegetative functions. By neurovegetative, I mean your sleep, your appetite, your sexual function, and everyday function. Now, that is when we say that you have an anxiety disorder. How do you know that you have an anxiety disorder? What are the symptoms that you see? In anxiety disorder, it is actually characterized by brief episodes of these symptoms. These episodes may actually last from 15 to 20 minutes usually, and it resolves on its own. But you can't assume that it is over because over time, these episodes increase in frequency and duration, and it becomes more disturbing for the individual. The symptoms that we usually see in clusters are you see palpitation, like I mentioned before, restlessness, tremors. Tremors means like shivering or rhythmic movement of your hands or your legs or your entire body in some cases. You feel dizzy or lightheaded. In some cases, you end up fainting, passing out. That's what doctors refer to as syncope. Stress headache is also a type of anxiety symptom, which is also very commonly seen among females. Now, these patients usually report a feeling of a tight band around your head. It is you feel like your head and your muscles are so crammed up, and it's a very dull pain, but it is very disturbing. And what happens is this usually doesn't resolve with painkillers. And it's the strain on the muscles that actually is responsible for the stress headache. The next symptom you see is hyperhidrosis, that is profuse sweating. Also, you have an increased urinary urgency, that is, you will rush to you will suddenly feel like passing your urine, but when you go, not necessary, it will go. There's a hesitancy also noted. Also, your frequency of visiting the toilet kind of increases. Abdominal discomfort, as explained. Some cases we see nausea, that is a tendency you feel like you want to vomit, and also diarrhea is noted. Some patients have also reported tingling extremities, like in your hands and your feet, you start to feel a little tingling sensation. Also, tachycardia, that means increased heart rate, is noted. Now, let's talk about what stress does on each system of your body independently. Let's start with brain. Now, what does stress do to your brain? A lot of studies have actually shown that stress gradually deteriorates your brain cells, as a part of which you should understand that your thinking becomes very difficult. You will find it very difficult to think straight. You will have more of pessimistic thinking rather than being optimistic, and you will have a lot of anticipatory worries that actually are occupying your mind. You do not tend to perceive information correctly. You hear something or you feel something, your perception of it will definitely get affected because of stress. The most important and the next effect is on our attention and concentration. We will not be able to focus on most of the important matter because we're so fidgety. As a result of which, our memory gets affected and learning new things become very difficult. When we go through this, eventually it doesn't get better. It just keeps getting worse. And what happens is you tend to actually you tend to notice that it is actually affecting your day-to-day functioning. Now, in your day-to-day functioning, when it's disrupting, your first concern is whether anybody is noticing or not, whether somebody can find this defect. So you have to make sure that it doesn't interfere with your function. Most of the people thus resort to substance. By substance, I mean alcohol, nicotine, stimulants like amphetamines, coffee, yes, even coffee matters, and or performance enhancers, sedatives, just to control your anxiety and to get more focus and attention. So what you tend to assume is that these substances will help you get through the day, or it will help with your functioning without anybody realizing. But what you don't realize is you're eventually becoming dependent on these substances, and these substances tend to worsen your anxiety eventually in the long run, and it might not be within your control very soon. Also, there have been increased cases of bipolar disorders following stress. And worst case scenario, studies have even shown that you can end up having schizophrenia because of excessive and prolonged stress. Next, let's talk about what happens on our cardiovascular system because of stress. As we can imagine, stress has a very negative effect on our cardiovascular system. As mentioned earlier, stress can cause increase in the heart rate and contraction of heart muscles and also constriction of blood vessels. As a result of which, our blood pressure increases, resulting in hypertension, blood lipid level increases, dyslipidemia happens, and also, as I mentioned before, clotting gets affected. When clotting gets affected, the reason is that cortisol, excess cortisol, acts on the inner lining of your blood vessels. Your blood vessels actually they do not function normally as they used to, which can lead to or trigger a condition we call as atherosclerosis. Atherosclerosis can further lead to stroke. Also, there are vascular changes noted. They say that when you're stressed, there is an excessive alpha adrenergic stimulation, which actually increases our heart rate. When our heart rate increases, there is more demand for oxygen. So when the demand for oxygen increases, what happens is coronary vasoconstriction, that is our heart vessels, get constricted. That is when a myocardial infarction, or what we refer to as heart attack, happens. And the gastrointestinal system, this is what we probably many of us might have experienced. when we are exposed to a stressful situation, our appetite is one of the first things that actually get affected. By appetite, I mean there are two types of changes that happen. In one set of people, what happens is your appetite actually increases. You tend to overeat. The reason is that corticotropin releasing hormones actually increase. That is, these glucocorticoids, they mediate your hunger and increase them. So in order to meet that needs, that craving, you actually go into comfort foods like chocolate or carb rich foods like cheese, which is very soothing and very rewarding you feel to put up with your stressor. This is what one section of people face. Another section of people, what happens is they go into undereating. So what happens is the corticotropin releasing factor in these people actually suppress their food intake. As a result of which, what happens is you feel full, but your stomach is actually not full. You never feel hungry. As a result of which, your absorption process in your intestine is affected, intestinal permeability gets affected, and in your stomach, what happens is there is more of mucus and acid secretion because food has not gone in. This can result in gastritis and, worst case scenario, gastric ulcers and bleeds. Stress actually increases the secretion of the substance P. Now, substance P is something that usually accelerates our inflammation process in our body, especially the abdomen. Now, what happens here is if you have a very silent or a previously undiagnosed, say, let's say colitis, that is inflammation of the colon, or it is a previously healed one, when excessive substance P is released, it can trigger this inflammation. And cortisol is very much responsible for the release of substance P. It has actually been also noted in studies that not only colitis, conditions like Crohn's disease, which is also an inflammatory disease, has occurred among patients who were stressed when compared to those who had less stressful environment. Now, what even there has been studies interestingly that children, when they are brought up in a stressful environment, or you had actually undergone stress during childhood, this can lead to these diseases actually occurring in your adulthood. That is, these Crohn's and the gastric ulcers and such diseases. Irritable bowel syndrome is actually a very interesting and, if you say, controversial topic nowadays. Now, what happens here is that there is a brain gut axis, that is a connection between the brain and the stomach. So, when there's chronic and persistent stress, there is an alteration in a hypothalamo pituitary axis that I mentioned before. And what happens is this brain gut axis gets affected. That's it. There's a brain gut disturbance in short. Now, what happens is you experience abdominal pain and discomfort frequently in a day, multiple episodes, and there will be a gradual increase in the frequency of passing stools and also your consistency of stool changes. It tends to become more loose in some cases. They say that when in irritable bowel patients, when their stress, when they are able to put up better with their stress, this the condition irritable bowel syndrome has actually completely resolved. What does stress do to your immune system? They say that multiple studies have actually shown that stress modulators, they cross the blood-brain barrier and they exert their effect directly on the immune system. So the general consensus is that people under stress are more likely to have an impaired immune system. When you have an impaired immune system, you're more susceptible to other infections and other conditions. So here, what happens is there has been a study which actually showed that melancholic women, that is depressed women, very stressed women, are more likely to have cancer than women who were more positive and exposed to less stress. Endocrine system. What does these particular hormones do on another set of hormones? Okay. Growth hormone. So there's been a study on children who was subjected to extremely stressful and hostile environment. They were kept there for some days to some weeks to see the effect on their growth hormone. Okay, so their growth was actually calculated to be much less than that of children of the same age under who were living under less stressful environment. When these children with a lower growth rate were actually shifted or removed from the stressful environment and put in a better environment, it was actually noted that these kids within a period of 3 months had a better growth rate, which is actually a shocking revelation of the fact that secretion of growth hormone will actually be stopped during severe stress. And also, studies have shown that in a study where corticotropin releasing hormone was actually administered into the brain ventricle, we could actually see in the PET scan that the release of the growth hormone had actually reduced. If you've ever wondered whether stress has contributed to your increased weight gain, especially around the abdominal girth area, then yes, stress definitely has played a role in it. What you need to understand is increased energy is required when you get stressed, as I had mentioned earlier. Now, to replace this loss of energy, we tend to consume energy dense food like carbohydrates, like I mentioned earlier, because of the increased craving. The craving occurs because the body needs that amount of energy to put up with the stress that you're going through. Now, this excessive cortisol actually ends up resulting in a central fat deposition, as you can see in the diagram. And cortisol also, in some cases, there is a signal called ghrelin. Ghrelin is actually in charge in all of us to, to motivate our appetite. So this ghrelin gets an enhanced push by the cortisol release, that is responsible for our overeating and we end up obese. WHO had actually estimated that diabetes is the seventh leading cause of death worldwide. In a study done in 2016, it was shown that 1.6 million deaths were directly caused because of diabetes. It is that common now. Another 22 million deaths were also attributed to high blood sugar in the further studies that came out in the upcoming years. What we need to understand is insulin, the production of insulin kind of decreases during stress. And because we don't have insulin, there is nothing fighting the rise in glucose, and we end up in a state of induced hyperglycemia. Also, as we had mentioned earlier, cortisol actually can convert the protein in our body into glucose. And obviously, when there is a continuous release of cortisol, there will also be a continuous release of glucose, resulting in diabetes mellitus. What happens to our reproductive system? In females, it is shown that stress actually suppresses the gonadotropins, that is the female reproductive hormones, and the gonadal steroid hormones, which leads to, first thing we notice is an abnormality in our menstrual cycle. That is, initially we notice that the cycles have changed slightly, and then it can further lead to complete impairment of the reproductive functioning also. What happens here is, among females, it can, like I said, it starts with a disrupted cycle followed by amenorrhea. That means for like a prolonged period, you will not have your menstrual cycle. In another case, there is anovulation. That means your uterine cycles are occurring, your menstrual cycles are occurring, but there is no ovulation, healthy ovulation happening, which will be difficult because you will find difficulty in conceiving following that. In males, we are very aware that semen quality is a key marker in the male reproductive health. But what happens in prolonged sex? What happens here is your sperm count is affected, it usually reduces. The motility of your sperm is affected, it becomes very slow. Your morphology of the sperm gets affected. You have ejaculatory disorders, you will have premature ejaculation, you can have erectile dysfunction, you can have impotence. Now, all these changes make it even hard to help in conceiving. Thyroid hormones. Stress is known to actually downregulate thyroid function. Chronic stress can actually reduce the production of thyroid stimulating hormone in some cases. What happens is that when you become very vulnerable to autoimmune thyroid conditions like Hashimoto's thyroiditis. Now, have you ever felt when you're stressed, have you ever felt very worn down, very tired, like you do not have the energy to just even get up from bed? Or have you ever felt that in a second, like you're having abnormal mood swings, like you're happy for 1 second and then you get very irritable, then you get very sad? And have you noticed that even without adequate food intake or a low appetite, you're gaining weight rapidly? Now, these symptoms, does it mean that you're actually stressed or that you have hypothyroidism? Now, these are symptoms of both stress as well as hypothyroidism, and they are interconnected. They actually feed each other. Stress can aggravate hypothyroidism, hypothyroidism can aggravate stress. So, you need to get it checked, get your thyroid levels checked, and find out what is affecting which one, and get both the conditions corrected. Because like for example, if you have a family history of hypothyroidism, what happens is you may not have checked your levels, or you may not know that you have hypothyroidism even though you are aware that members of your family has it. Now, under stress, your body releases cortisol, as mentioned earlier, and these cortisol actually interfere with the thyroid hormone production. Now, that can stimulate your thyroid to work harder to create sufficient amount of thyroid hormone, which ends up in these symptoms like fatigue. In spite of sleeping for 10, 14 hours, you'll be very tired, you'll have weight gain, you'll have joint pains, your skin becomes very dry, your hair becomes very brittle, it falls off easy, your voice changes, it becomes very hoarse, you have poor concentration, you will have those memory loss, you will have swelling of neck, which might not be very noticeable, but in some cases, yes. And you will have cold intolerance. You cannot, even though it is hot for others, you alone will be feeling cold mostly. In another scenario, what happens is you have your body undergoes a physical stress, for example, like a heart attack. Now, if you have an untreated thyroid condition like hypothyroidism or Graves' disease, this physical stress can actually cause a life-threatening thyroid storm. Now, in thyroid storm, how the symptoms occur is you'll have a high fever, you'll have a rapid or irregular heartbeat, you'll have tremors, and you'll have vomiting or diarrhea. If this is the case, you should get yourself immediately checked, because thyroid storm is actually a medical emergency. From our discussion so far, we have established the fact that stress is more of a physiological problem, which results in psychological effects in our body. Now, let's talk about what we can do about to correct this hormone imbalance, because if we correct it, we have a way out of it. Treatment includes pharmacotherapy, that means drugs, and also side by side psychotherapy. Pharmacotherapy, we do it to fasten the action and to get a fast result. Now, these are not drugs that you make you dependent on them, or it's not like if you stop the drug after an adequate period of treatment, you cannot function properly. No, these are not drugs like that. These are actually antidepressants, whose dosage can be adjusted to your level of stress. We have SSRIs nowadays, we have tricyclic antidepressants, we have SNRI, and multiple other new generation drugs with lesser side effects. And it's not like before where you have potentially or dangerous, harmful side effects, manageable side effects, and also very effective ones. To speed up the action of antidepressants, we do supplement in some cases with benzodiazepines like lorazepam or clonazepam, but we do not continue these sedatives for you. We gradually taper and stop them so that you can function without medications eventually. The next, what we do is psychotherapy. There are a lot of psychotherapy interventions that can be done, but today I will be talking about only three psychotherapy types. That is, one is the most important one, cognitive therapy. So now what happens when you're extremely stressed is you have a way of viewing yourself, you have a way of viewing the world, you have a way of viewing the future. Yourself, you the way of viewing yourself, your self-esteem is extremely low and it keeps getting lower. You will have absolutely no confidence in whatever you do. You have a negative view of your future. You feel like sometimes nothing will go right, or you have a confusion whether it will go right, whether it will improve or not. Basically, your future looks very bleak to you. And also, the world, especially in the current situation where we're facing the corona threat, we do not know if the world will recover from it or not. So, our view in cognitive therapy, we actually address the patient's belief of these three views and we work on it. We tend to improve it so that the patient can actually resume to the normal life of positivity. Behavior therapy is the next therapy that we usually give. Here, we do a behavioral analysis. And in this analysis, we also eventually encourage you to learn new methods of adapting or adjusting to the world and the changes. Last but not the least, systemic desensitization. Now, this includes three steps. First, we make a list of all your stressors or all the things that worry you. We put them in a hierarchical order, in an ascending hierarchy, that is, what affects you the least and afford till what affects you the most, which is least scary, which is most scary. Then we teach you relaxation exercises, which will help you calm down. One by one, we will address each stress of yours in the list and we desensitize you to this fear. Eventually, we will help you. Each item in the list, we will address it and we'll help you overcome each of these fears or each of these worries and resume to your normal life. So, what is your next move? Like, will you will always be facing stressing situations at every step in your life. If you think today it's over, it's not. It'll come up again. It depends on how you perceive it. And if you're not able to adapt to these changes, you should know that you're not alone in this. You should know that help is easily available and you don't have to go through this in alone, scared to ask for help. You can come out of it and you can actually resume a normal life and function if you just seek help. So with this, I would like to conclude my presentation. Thank you so much for your